Okay, this is part 2 in the series of lectures called From Mouth to Mitochondria. The idea being we're going by the anatomical areas. That correlates well like with a medical school education to do anatomic regions. It's also simpler, I think, to understand. Okay, so we did the mouth highlighted in yellow. Now we're going to do the gut today. This is a very useful lecture. I'm going to tell you stuff that you really want to know this. Okay, so the first thing to understand about the gut is you should know abdominal pressure syndrome. Abdominal pressure syndrome comes from Dennis Burkitt. He was an Irish surgeon, a Christian missionary to Africa. He was a genius, very humble, but a brilliant guy. And he basically noticed a pattern. You know, he did some of his work, of course, in England as well. When you're dealing with a Western population eating high-fat diets, they're going to have constipation because there's very little fiber in white bread and jam and tea, you know, the people in England are eating in Ireland. So they're constipated because fiber attracts water to itself, and it makes the stool more bulky. So because of that, what happens is a normal bowel movement, you should know this, it should be like a cow patty. It stretches the walls of your rectum, and then that causes a reflex contraction. The key point is that it's reflex. It's involuntary. It happens automatically. So when the moment of defecation arises, you just, open it up and, drop a few on, okay, whatever. All right, so it's effortless. And so it should be big and soft, like I said, kind of similar to a cow patty or very soft logs, like a little swirly or something. All right, well, anyways, if you don't eat enough fiber, the average American only eats about 5 to 10 grams of fiber per day. Burkitt thinks we're designed to eat about 100. You should really get in a minimum 40 or 50. What'll happen is you're constipated, so you're popping out little goat pellets or Tootsie Roll like stool. And then you have to strain a little bit, tighten up your abdominal muscle. Tightening up your abdominal muscle is called a Valsalva maneuver. When you have that Valsalva maneuver to exert pressure on your rectum, it also pushes pressure up into your abdomen. And that has effects. It pushes down on the rectal veins, increasing your risk of rectal hemorrhoids. It pushes on the veins that go into the scrotum. You can get a scrotal hydrocele and dilate the veins in the scrotum, and that heats up the testicles, can cause infertility. It'll also push pressure down into the leg veins and cause varicose veins in the legs. It pushes back pressure into the sigmoid colon. That'll cause diverticulosis. If a diverticulosis outpouching between the little muscle bands, taenia coli of the sigmoid colon, if you outpouch the colon and it pops, that's called diverticulitis, and you spill stool into the abdominal cavity, into the mesenteric fat. Very painful. Sometimes that can lead to an abscess. I drained over 100 of those. It can lead to the need for surgery with a sigmoidectomy. Can even need a diverting colostomy. No fun. Okay, I've known doctors who had those surgeries. All right. Also, the back pressure can push a hernia out. Inguinal hernia can push out a periumbilical hernia. It's all bad. All right. Like I said, I got a friend, this doctor. He said, in my country, he's from like Iran or something in the Middle East. He's like, we have no diverticulitis, no diverticulosis because we eat fiber. Okay. It's a guy had no reason to lie to me. All right. What's next? Also, it pushes your stomach up into your chest, the lower part of the stomach, because you keep widening the hole in the esophagus, in the diaphragm through which the esophagus passes. That's called the esophageal hiatus. So to have a hernia in there, it's called a hiatal hernia. And the stomach pouches up into the chest, and then it becomes what's called a hiatal hernia. Typically a sliding hernia, it just goes straight up. And it causes some incompetence of the lower esophageal sphincter, so you get gastric acid going into the lower esophagus. That's not good. So the inflammation causes what's called reflux esophagitis. So GERD means gastroesophageal reflux disease. Reflux esophagitis means it inflames that lower esophagus. And then over time, the epithelial lining of the cells that are in contact with the lumen of the esophagus will sort of form this new hypertrophied squamous type of structure to help protect themselves from the inflammation, and that can progress. It becomes called Barrett's esophagus, can progress to esophageal adenocarcinoma. And that's relevant because when I was a young guy, people got smoker-drinker esophageal cancer, alcoholics and cigarette smokers. But nowadays, it's more common to get adenocarcinoma from gastroesophageal reflux. I see a lot of those. I've seen some really good people die from that. Okay, now I also want to talk right now at this point about hot disease versus cold disease. This is a very useful concept to remember the rest of your life. Hot disease means an acute disease, inflammation. Okay? And so all the immune system comes in, releases all their, cytotoxic chemicals, their cytokines, their other inflammatory chemicals. They make like bleach, okay, hypochloric acid and whatnot. And that causes acute inflammation, swelling, pain. Inflammatory signs are quite plain: redness, swelling, heat, and pain. All right, well, anyways, over time, it starts healing, so to speak, and fibroblasts move in, and they release, they produce fibrotic tissue, which is like collagen, scar tissue. Well, that scar tissue envelops some normal cells, and when it envelops the normal cells, it decreases the blood flow to them, the oxygen delivered to them. They become hypoxic. Okay, so this is a very important point. Acute disease, inflammation, pain, swelling. Cold disease, old disease, chronic disease is fibrosis and scarring with resultant ischemia, lack of oxygen delivered to the tissues. Well, that lack of oxygen is also called hypoxia. Hypo means less, oxia means oxygen, and that leads to the Warburg effect, meaning that the lack of oxygen will damage the mitochondria, and some will be at risk to transform into cancer cells. A cancer cell is like an anaerobic bacteria. It no longer cares on doing its job as part of an organ system. It just wants to grow, to proliferate, to spread to other locations. That's cancer. Transformation of a normal cell, like a eukaryotic cell, running on oxidative oxygen metabolism to make ATP, switching to being anaerobic, metabolizing without oxygen, and just wanting to proliferate. So that's Warburg effect. Okay, so what's my point? This increases your risk of cancer, dramatically so. And that's the metabolic theory of cancer. And the great thing about the metabolic theory of cancer is it tells you what to do. Avoid things that are going to cause hypoxia, like hypertension, obesity, diabetes, atherosclerosis. Versus the traditional way of thinking about cancer, what all the medical students have taught is called the SMT, somatic mutation theory. The best book on this subject was the Tripping Over the Truth by Travis Christofferson. By the way, for treatment of esophageal reflux, you can do the elimination diet. I made videos about that. Dr. Kempner has a great newsletter on that subject as well. Okay, so that was we just covered some really big stuff there. Abdominal pressure syndrome. You want to know that I got a whole video on that. I made a real nice video about that called the Western Abdomen. I have a video version of that discussion over at the Chef AJ channel. I have a video version discussion of that over at Veg Source, and I think on this channel too. Okay, then we talked about the whole concept of GERD and esophageal cancer, and really the most important thing to get out of this is hot disease, cold disease. Hot disease, edema, pain. Cold disease, fibrosis, scarring, causing tissue hypoxia, cancer risk. Okay, that's real important to understand that. And how the metabolic theory of cancer kicks the crap out of the somatic mutation theory. MTC for metabolic theory of cancer. And this book went through all the data supporting it. When they did the Genome Atlas project, it was an embarrassment to the cancer industry because they found there wasn't any set pattern of mutations, what they had expected to find, meaning that there was sort of a randomness to these cancers, meaning that there wasn't just one mutation either. There was a whole bunch of like shift change where you switch from aerobic to anaerobic metabolism, and all this stuff fits well with the metabolic theory of cancer. It does not fit with somatic mutation theory. I think the somatic mutation theory is relevant in some isolated circumstances, but the MTC is the big deal. That's what you want to know, and what's wonderful about that is it tells you exactly what to do. There's tons of things you can do to avoid the metabolic theory of cancer. Okay, leaky gut. Very common. Increased intestinal permeability has multiple serious consequences. Okay, normally what happens is the gut feeds, good gut bacteria feed on dietary fiber. The dietary fiber is taken by the good bacteria, they convert it to butyrate, which is like butyric acid. Think of it as being like a butanoic acid, a 4-carbon carboxylic acid, very simple molecule. It's like a 4-carbon short-chain fatty acid. That's what it's also called. And then the enterocytes, the gut's the enteric tract, so enterocytes are the gut lining cells. They use that to make tight junctions. And then the tight junctions block stuff out so the bad stuff can't get across the gut wall into the blood vessels, into the gut wall and cause inflammation or get into the blood and cause systemic problems. Systemic means throughout the body. All right, so anyways, what happens when you don't have dietary fiber? Then you get leaky gut because you can't make the tight junctions, and now stuff can leak across the gut lining. That's called increased intestinal permeability and cause major problems. All right. First of all, you can inflame the gut wall. That'll cause irritable bowel syndrome. That'll cause Crohn's disease. That'll cause ulcerative colitis. All right. then these bacterial toxins, LPS from gram-negative bacteria, here it is, LPS from gram-negative bacteria, that stands for lipopolysaccharide, LTA, lipoteichoic acid from gram-positive bacteria. Those will get across the gut wall and go into the blood. It happens after a meal, so it's called prandial means meal. So postprandial means after eating, endotoxemia, bacterial endotoxins. LPS and LTA are bacterial endotoxins. They get into the blood. They'll change the shape of fibrinogen, the clotting protein, from alpha helix, like a cylinder, into beta-pleated sheath, flat like a deck of playing cards. They stick together, and that's to form a clot. They precipitate out of solution in the blood. That's called amyloid clotting, also called fibrinolytic clotting. Douglas Kell, Etheresia Pretorius, PhD. She's from South Africa. He's from England. They did most of the work on this. Beautiful papers. They deserve a Nobel Prize, but they'll never get it because they don't want the public to know about this. All right, so anyways, that predisposes you to clotting. Those little clots are called fibrinolytic microclots, typically 2 to 200 microns in diameter. They go around the body, plugging up capillaries and also plugging up, arterioles, and it's bad. This contributes to cognitive decline, atrial fibrillation, and other conditions. You don't want your blood vessels being plugged up. So you don't want postprandial endotoxemia. What else causes it? Well, high-fat diets cause it, okay? The high dietary fat is toxic to the gut wall, and so is those omega-6 cooking oils, so is alcohol, so is fluoride, so is aluminum, so is excessive amounts of chlorine, so is glyphosate, okay, and then there's a whole bunch of other things. A lot of the preservatives in processed food, carrageenan, for example, the emulsifiers. Fatty acids are amphiphilic, meaning they're part polar, part nonpolar, and that can sort of intercalate and be disruptive to plasma membranes of the gut wall as well when it's present in excessive amounts. Okay, but here's another big one. You might not even heard me talk about this. I have talked about this in a few lectures and in my Food, Mood, and IQ book. But LPS and LTA, because you've got leaky gut, you're also going to have leaky blood-brain barrier, because the blood-brain barrier uses the same thing. Butyrate gets into the blood, travels to the blood-brain barrier, endothelial cells, they use that to make tight junctions. So when you have a deficiency of fiber, you're going to also have a leaky blood-brain barrier. And that's very common. When there's a leaky blood-brain barrier, there tends to be leaky gut, like from head trauma or from a stroke. And when there is leaky gut, there tends to be leaky blood-brain barrier. So now you're going to have endotoxins getting some contact to peripheral, superficial parts of the brain. And this can trigger neuroinflammation, whereby they activate the brain guard cells. They're called microglia. They're the macrophages of the brain, the residential macrophages, sentinel macrophages, as you could call them. And then the microglia senses, incoming bacterial invasion, releases toxic chemicals to sterilize the area, to kill the bacteria, so to speak. But that'll cause collateral damage to the adjacent brain cells. And when that happens on a chronic basis, you're constantly losing a couple brain cells every day. You don't want to do that. Even though you have a lot of them, you don't want to be losing them for no reason. Also, this can cause activation related to the microglia of the whole no cycle, the nitric oxide peroxynitrite cycle of Martin Pall. I've given lectures about that. That's kind of a complex subject. But the bottom line is it causes inflammation in your brain for no reason. You don't want that. That's associated when it's really, 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 really bad. You can even be associated with things like chronic fatigue syndrome and cognitive decline. In addition, microglial activation can activate something called the kine-urenic pathway. Kine means like dog, uranic means urine. They studied this from dog urine. That's how they figured it out. And it'll lead to the production of more quinolinic acid. Quinolinate, you sometimes hear it described as. That's an NMDA excitotoxin, meaning that it increases the activity of the NMDA receptor, which is a glutamate receptor, calcium channel. It'll allow more calcium into the cytoplasm and neurons. In addition, it'll divert tryptophan away from making serotonin, so it'll cause a deficiency of serotonin, which decreases the person's motivation. Kind of is connected to what you would call sickness behavior, where a person just wants to withdraw, lay in bed, and not do much to sort of like save their energy resources to fight the infection, and also theoretically from an evolutionary point of view to withdraw away from others so they don't get the same disease. So anyways, it's all bad. Inflammation of your brain, risk of autoimmune disease with that molecular mimicry with autoantibody cross-reactivity. I didn't explain that autoantibody stuff that well, and I've previously made lots of videos about it, but the bottom line is only single, double, or triple peptide, 1, 2, or 3 amino acids can get through the gut under normal circumstances for absorption. But when you have leaky gut, a big chunk of protein can get across. And if you're eating animal protein, that can have similar enough structure to the proteins in your own body that your immune system will form antibodies to it in the gut wall when it first comes in across the gut wall lining. But those antibodies travel through the blood and they can potentially react with other parts of your body. So molecular mimicry in that the animal protein amino acid sequence and then subsequent shape of the protein mimics those of your own body. And then you make antibodies called autoantibodies, meaning they attack yourself And to attack yourself is also called cross-reactivity. So molecular mimicry with autoantibody cross-reactivity, that's the most common mechanism of autoimmune disease. And the way you prevent it is eat adequate dietary fiber by eating lots of plant food and avoid all the bad stuff. Avoid the processed food. Filter your drinking water. Only eat organic. Okay, so those are the most important things to know about the gut. I hope you found that helpful.